The best way to protect yourself from COVID-19 is based on the advice that is very much out in the public domain at the moment. And what I like to say is that you wash your hands, for at least 20 seconds, as often as you possibly can. Don't touch your face. And the cough and sneeze etiquette that people are talking about as well, as cough or sneeze into your elbow. And that should become second nature to us all. It's lovely to see kids are actually kind of even saying these things to us back now. So it's lovely. So this is good etiquette for the distribution of any illness, and it's when the seasonal flu comes in, but for COVID-19 we need to get that message out there that wash your hands, don't touch your face, cough and sneeze etiquette. It spreads by droplet infection. So that's basically droplets being the mucous membranes of your nose and your mouth and your respiratory organs can produce droplets. Like, if you've cold, your nose is runny, it's that. So that if you sneeze or cough, you're going to spread it that way. It doesn't hang in the air for an awfully long period of time. It stays on surfaces, but possibly only for about 3 hours. And it isn't airborne. So if you're in an area that somebody who has had COVID-19 is in, you're not at risk from that point of view, just from the air that surrounds you. But droplet infection is how it spreads. To be honest, from the point of view of who's at risk for contracting COVID-19, everybody is at risk. What we do know, however, is that people who have immunosuppression in some way or immunocompromised or elderly people are more at risk of a more severe illness. Thankfully, 80% of people who do develop COVID-19 have a very mild illness, and most will be managed in a home's environment. But if you are older and if you have an underlying condition, you are more at risk. We know that children get the illness too, but they tend to get a very, very mild illness and may not even present. That in itself causes a public health issue, though, because children may be carrying illness and not be aware of it. Well, the symptoms are the same as the symptoms of any respiratory infection. So basically, runny nose, cough, sneeze, they will be the signs of most respiratory infections. Sore throat can be a particular sign of flu-like illness as well. That doesn't tend to be quite as obvious with COVID-19. The symptoms seem to be temperature, cough, shortness of breath. Basically those quite extreme lower chest symptoms as opposed to upper respiratory symptoms. But this is an evolving process and we can't be sure of that. So anybody who has infective symptoms that are respiratory nature, we would have to be suspicious at this stage. Well, the first thing they do is there's 3 parts of this really, is you have to be responsible for yourself, look after yourself, you have to be responsible for your family and the wider community as well. So the first thing you should do is call your healthcare professional. You don't come in, and we can't stress that enough. You really should not present yourself into an A&E service or a doctor's surgery. Call and your doctor will give you advice over the phone. And you may be then redirected, depending on whether or not you are somebody who needs to have further investigations, redirected to a public health number which your doctor will give you. The test involves nasal swabs or throat swabs. They're not the most pleasant thing. It's a swab that's put up to your nasal passages, but they're very accurate, and the same swabs that we would use for seasonal flu or any viral illness. Well, that's a tricky question in some ways. Self-isolation is, the advice you would give for somebody who, like the schools that are closed, they go home, they self-isolate. They really should not be mixing in any large groups of people, really should be staying at home. Really close contacts are defined as somebody you've been in contact with for more than 15 minutes within 2 meters. So that you try to avoid situations where that would occur. However, if you are a proven case of COVID-19, self-isolation is much more extreme. In that situation, people who you're dealing with would have to be gowned and masked. So it differs for different people. But I think you can't stress enough that individual responsibility is huge here. If you're in that situation, if you've been told to self-isolate, you have to be cognizant of the wider community and that you really need to protect everybody else. If you're vulnerable, if you have an underlying health condition, the advice is to be even more cautious, really. I mean, this is my opinion. We have to follow WHO guidelines. We have to follow the Department of Foreign Affairs guidelines. And we have to follow HSE guidelines. And they're all designed to help protect the wider community. But with people who are a little vulnerable, they maybe need to be just that little bit more cautious. I would advise that they wouldn't go to any gathering where they will be in that definition of close contact with people while this is prevalent in the community. That isn't, I don't think there's any guidelines about mass gatherings right now, but that's changing. And it's a very fluid situation. Going to mass, shaking hands, all of that kind of thing. I think they should be very, very cautious if they are, especially if they're immunocompromised in some way. Well, what we're given, I'm giving that advice exactly to my patients. I spoke to a number yesterday, and I suppose I was saying to them, God, maybe you shouldn't be in here. Thankfully, we have no case or anything, but you really want to avoid situations where you're putting yourself at risk. So I've been telling them to really stay home as much as they can, stock up on things they need, have other people help them if they need to, make sure they're taking their medication, make sure they have stocked up on their medication. If they have respiratory symptoms, make sure they're actually taking their inhalers and stuff. I've had that conversation a couple of times because we're coming into a slightly better time of year. Maybe sometimes people are a little more lax. So yeah, it's really look after themselves as they always would, but listen to the advice that's been given. Well, this is really my own opinion as opposed to, because like I say, it's a fluid situation, but given what's happened over the last 24, 48 hours, I imagine this is our new normal, that this is going to circulate for a number of months at least. And we just have to find ways of managing it and dealing with it. Thankfully, most people don't become seriously unwell. If it circulates in a kind of a low-grade fashion, the health services will cope very, very well. If it were to peak, and if people were irresponsible in their behaviour and there was peaks because of that, then we may have bigger issues with the health services. But no, I think we have to get used to this. Mm-hmm. There's a helpline, and the HSE helpline it's a very easy number to remember. It's 1850 24 1850. And that would be your first port of call. There's an awful lot of information online. If you can't access online, ring the helpline number. Keep yourself informed. Don't panic. There's no point in panicking. Like I say, this is something we have to become familiar with, learn how to cope with. But be responsible. I think that's the big thing. I'm getting a number of questions about people. Will I go on holidays? Will I not? That's your decision. We can't make decisions like that for you. Follow the guidelines that are there and the information that's there, and make your decisions about responsibility for your own health and the people around you as well.